Welcome to our second class on disability embodied in language. Here we will use Crazy Cripples and South Park and other movies to talk about disability and language. Here is the overview of the class. We will talk about the article by Simi Linton, Reassigning Meaning. We will talk about the article or book chapter Lame Idea, that is on language, metaphors, and labeling. And we will also touch upon South Park and Family Guy and how they use and the satirical animated series to portray disability in our society. Simi Linton wrote an article where she discusses disability language. She explains terms such as ableism and ableist, which is the domination of non-disabled experience or discrimination based upon ability. She talked how language developed from crippled to handicapped to disabled, and she also gives us definitions of disability that include incapacity, disadvantage, impairment that restricts normal achievement, or disqualification. If you notice, all of these are negative. She says that there are bad words and nice words. Terms like challenged, special needs, differently abled, able-disabled, handy-capable even, were mostly created by the good-doing paternalistic able-bodied people, but they do no good to people with disabilities. She talks about how special created an entire industry around the word special, and how being called special is offensive in education. Nowadays, you can even hear people say that inclusive is negative, or how we talk about inclusive education. So inclusive is pretty much the same as special, or the same as disabled, or handicapped, or any other labels that were created in the past. The book chapter Lame Idea that was written by my classmates when I was in Syracuse, at Syracuse University, is on the use of disability as a metaphor. And they say that it perpetuates false beliefs about the nature of impairment and disability. People who are blind, for example, do not lack in knowledge. They simply have different ways of obtaining it. Paralysis does not necessarily imply lack of mobility, stagnancy, or dependence, since there are augmentative instruments such as wheelchairs and personal aids that secure independence and mobility. Disabling language is language that accepts the assumption that disabilities are bad, unfortunate, or denote lack or deficiency, that they are invisible and insignificant to society as a whole, and that disabilities belong to the other and are distinct from what we would term as normal. What this language hides, however, is that there is a power struggle of definitions, that normalcy is culturally determined and ever-changing, and that there are more people who are defined as having disabilities than we acknowledge. The book chapter Lame Idea further explains that disability is not a metaphor, it is an identity. The authors ask, how can we refer to disability as an identity and to people who embody this identity and not be offensive? For example, in the United Kingdom, people commonly say disabled people. In the USA, people commonly say people with disabilities using people first language or person first language. There are also terms with capital letters such as deaf and autistic. The capital letter signifies identity and pride. There are also terms such as handicapped or mentally handicapped. And there are also value-laden terms, which are emotive terms relating to disabled people such as afflicted, restricted, stricken, sufferer, unfortunate, and victim, and they tend to reflect a person's negative reactions to a disabled person. There are also terms such as challenged, trying to be more positive and more politically correct, and there are also we also use words such as someone with special needs. So these are all terms that developed, but the way we should talk about people is to ask them how they want us to talk about them. So if there's a person on a wheelchair, we should just ask them, what term do you go with? Do you call yourself a cripple, or do you call yourself a person on a wheelchair, or do you call yourself are you part of the group of crips, for example? So we should just ask the person before we label. Here's a fun activity that my classmates also developed, and it is a little introduction to their book, Building Pedagogical Curb Cuts. Lame idea is part of this book, and they created this activity to show how we often use disabling language in our speeches without even noticing. So this is what they said, and I want you to listen to that and underline or think of words that embody disability as we talk. So here we go. We are here to talk about how to include disability in the curriculum. We hope this discussion won't fall on deaf ears. We aren't blind to the fact that it may seem crazy to try and include a disability perspective in every discipline. Some people may feel paralyzed when trying to discuss disability, but we think it's lame to leave out disability. So, in response, we have edited a book in coordination with the graduate school called Building Pedagogical Curb Cuts, incorporating disability into the university classroom and curriculum. This is an insanely long title, but we feel it addresses the crippling effects of disability absence in discussions about diversity. We would also like to thank our authors because this book is a result of their inspirational stories and courageous efforts. So if I go back, just to give you a few hints, the first disabling language would be deaf ears. Then we aren't blind, what may seem crazy. We often say that in language, right? That's crazy, or that's insane. But all these are terms that have something to do with disability, and someone may feel offended if they're around, and if they, for example, have learning difficulties or have some mental challenges, and if they hear us say that's crazy, they might just feel offended. So be careful when you speak what language you use. Labels very often become bad. What first develops as a terminus technicus, which is something neutral, then it becomes vulgar or a pejorative term, and it starts to be used for calling someone bad names. I want you to think about some examples that you can give me. Something that developed as a label first and was very neutral and nice, and then developed as a bad language. And on the next slide, you can read some examples. For example, deaf and dumb. It first referred to people who were deaf and couldn't speak, but deaf and dumb started to mean stupid. Deaf mute, mongoloid, crippled, gimp, retarded, idiot, imbecile, feeble, retarded, crazy, maniac, insane, mentally ill, abnormalities, a typical feeble-minded freak, vegetable, stupid, as a broom, they say in France, and so on. You can probably think of many others. Most of them have something to do with mental disability, if you notice. Naming has been developing. Eli Clare, who is now she is a man, but she used to be a woman. She is a transgendered woman. She wrote in her book, "Sticks and stones may break my bones, but names will never hurt me." And there's another quote by Du Bois from 1928. He says, "I used to be a crippled Negro, but I have to be used now I have to get used to be called black and disabled." Here you can see how names develop and how gradually they become, first they are nice, but then they gradually become bad. In his article, "What is in a Name?" Tajani says, "There is plenty in a name, according to minority rights groups who have worked throughout the 20th century to identify themselves using descriptive, reflective, and respectful labels. These labels often have been replacement terms for those created by people outside of the group in question." So we developed from being colored to Negro to black to African American. And here's a little cartoon about terms that we use and about disabling language that we use. And here is a piece on language by Paul Longmore, who has been a disability advocate and a disability activist and a professor for many years. He said in his book that frequently used terms also express perceptions of helplessness and dependency, such as victim, abnormal, defective, infirm, invalid, unsound, or maimed. Many terms could be described as medical labels, in that persons with disabilities are often described as patients, cases, or as sick with, afflicted by, suffering from, or stricken with one condition or another. Regardless of the social situation, people with disabilities are often labeled and perhaps viewed primarily as objects of medical treatment. Another set of terms substitute and euphemistic labels in an attempt to weaken prejudice. A third, politicized language is being formulated by persons with disabilities, which reflect a contemporary effort to escape the handicapped role and to create an alternative self-defined social identity. The next slide has APA guidelines. APA is the American Psychological Association, and they came up with guidelines about how to talk about people with disabilities. This is really important, and I want you to keep that in mind throughout the entire course. First of all, they say do not focus on disability unless it is crucial to the story. Avoid tear-jerking human interest stories about incurable diseases. Focus instead on issues that affect the quality of life, such as accessible transportation, housing, affordable health care, employment, and so on. Put people first, not their disability. Say, woman with arthritis, a child who has a learning disability, or a person with a disability. Labeling the person as the disability, for example, a quad, dehumanizes the individual and equates the condition with the person. However, there are some disability advocates who use the term disabled person as part of their disability, such as deaf. They say I'm deaf, or I'm autistic. They refer to themselves by the disability. Do not portray successful people with disabilities as heroic overachievers or long-suffering saints. There are no superhumans. Saying afflicted with, crippled with, victim, or sufferers from devalues individuals with disabilities. Emphasize abilities, not limitations. For example, say, he uses leg braces or walks with crutches, rather than saying he's confined to a wheelchair or he's wheelchair bound. I often read that in your papers, so please do not use these terms. Bypass condescending euphemisms. Terms such as handicapable, differently abled, special, or challenged reinforce the idea that people cannot deal honestly with their disability. Maintain the integrity of each individual. Do not use words or phrases regarded as offensive, such as freak, subnormal, vegetable, and so on. So keep the APA guidelines in mind when writing your papers for this and other classes. It will really help you. Now, there is stories about overcoming and passing. People with disabilities are quite sensitive to these. They want to live lives just like anyone else, and they don't want to be heroes or exceptional. I wonder if you can recall any media stories. And on the next slide, there is a video. I want you to watch that video and tell me if you think that the boy is overcoming his disability or if he's just doing what he enjoys. Another article by Jim Sinclair titled Why I Dislike Person First Language was part of your readings. So I would like you to summarize the 3 reasons he gives why he prefers to be called autistic and not a person with autism. And if you don't remember, go back to the article. Now finally, there are 2 shows, South Park and Family Guy. They are very popular in the US, and they also deal with some disability and disability language. Can you think of the characters in South Park? And I want you to think about first what is the purpose of South Park and what are some implications for our society. Do the same with Family Guy. Think of the main character and how he portrays and mistreats people and how he regards differences. And in some episodes that you can watch, you can hear terms such as retarded. They talk about ADHD. Crazy Cripples is one famous episode, and so on. And here's examples of some YouTube links and pieces of South Park and Family Guy. If you have a chance, I want you to watch the full episode. There is examples, Crazy Cripples and Special Olympics. There is a Family Guy episode on Stephen Hawking. And I want you to focus on the language that they use. And in your Blackboard discussion on forum, please discuss the movies, discuss the disability examples embodied in language, and the articles that deal with that. I'm looking forward to our discussions.